you ever seen a chicken do this? It looks like they're squawking, but there's no sound. Could they be yawning? Probably not. Most likely she feels a tickle in her throat and is trying to ease it. And what's causing that tickle? Well, it might just be a little red worm called gapeworm. I recently had a chicken who showed signs of gapeworm, so that sent me on a quest to find out more about it. Gapeworm is a nematode. That's a kind of worm. Its scientific name is Syngamus trachea, and it has other common names, including redworm, forked worm, or Y-worm. It's a parasite that infects birds, including chickens. Actually, chickens are not really the preferred host of the gapeworm. It prefers to live inside pheasants or turkeys, but it's not really fussy and will infect lots of other kinds of birds, including guinea fowl, meadowlarks, crows, blackbirds, ducks, geese, seagulls, pigeons, canaries, and even the New Zealand silvereye. As you might guess from that, gapeworms are found all over the world. The gapeworm is also opportunistic when it comes to its life cycle. The adult gapeworms live in the chicken's trachea, that's her windpipe. The gapeworms produce worm eggs, which can either be coughed up by the chicken directly onto the ground, or if the chicken coughs and then swallows, the worm eggs will pass onto the ground with her droppings. The worm eggs can sit waiting on the ground for months, or alternatively, the worm larva might hatch out in a few days. The larva might be eaten directly by chickens and so go on to infect the chicken who ate it. Or they might be eaten by wild birds, whose droppings later contaminate the chicken run. Or the larva might be eaten by an invertebrate host, such as a snail or slug or even an earthworm. Gapeworm larvae can't develop into gapeworm adults inside the invertebrate host, but they can live there for a long time. In fact, gapeworm larvae have been found to survive for over 4 years inside an earthworm, which is fascinating. I didn't even know that earthworms could live so long. Of course, gapeworm larvae inside an earthworm or beetle are in an ideal situation to be eaten by a chicken. So one way or another, the gapeworm larvae end up back in a chicken. Inside the chicken, the gapeworm larvae migrate from the chicken's intestine through her bloodstream to her lungs, developing and maturing along the way, and finally to her trachea, about 18 days after the chicken ate the gapeworm larva. The male adult gapeworm attaches to the wall of her trachea, and the female gapeworm, who's about 4 times the size of the male, attaches to the male gapeworm. This odd arrangement is what gives the gapeworm its typical appearance, like a Y shape. It's actually 2 worms joined together. The gapeworms feed off the blood of the chicken, which makes the gapeworms deep red. It's not nice having worms hanging around in the back of your throat, but most adult chickens can cope. Adult chickens usually have some resistance to infection by gapeworm, but chicks under a couple of months old are much more susceptible. The gapeworm larvae and adults can cause scarring on the chicken's lungs, and if there are a large number of the worms, they can be debilitating, eventually making it difficult for the chicken to eat and drink. And the massive worms can even block off the chicken's airway. Small chickens, like bantams, are especially vulnerable because their airway is smaller. So how can we make sure our chickens don't get gapeworm? Well, we could just not let our chickens free range. Chickens that live confined indoors are not exposed to the gapeworm larvae from earthworms or bird droppings, although it is still possible for the gapeworm larvae to sneak in using any beetles or grasshoppers that wander into the chicken house. Personally, I prefer to allow my chickens to range and to find and eat bugs and earthworms, so gapeworm is a risk I have to manage. We can reduce the exposure by rotating the ground that our chickens range over, so the number of gapeworm eggs and larvae don't build up over time. Since I live in town, I only have a small area for my chickens and not much opportunity to move them to fresh ground. Removing any large amounts of chicken poop, liming the soil, and keeping the ground well drained also minimises the numbers of viable worm larvae in the area. And try not to attract large numbers of wild birds. Any chicken feed left available will attract sparrows, so I use a grandpa's feeder to minimise that. But I do like to see the native birds enjoying my garden. Because young chicks are more vulnerable to gapeworm infection, it can help reduce their exposure if the chicks are raised away from adult hens and areas where adult chickens have been. When I incubate and raise chicks, they don't go out into the chicken run until they are a month or two old, by which time they are developing some resistance to infection. But this year I let my broody hen raise chicks from hatching right in the chicken run. Now that's more risky insofar as parasites are concerned, but I have to say that it is heartwarming. So if I can't prevent gapeworm, I just need to be aware of the possibility and ready to treat it. This gaping action is the most typical sign of gapeworm. The chicken might also cough and shake her head. If the infestation is severe, then she might lose condition and look ill. If the gapeworms are across her airway, she might make a whistling or grunting sound when she breathes. This video is actually not of my chicken, but it demonstrates very well what the typical sign of gapeworm looks like. But just because a chicken is breathing through her mouth doesn't necessarily mean she has gapeworm. Chickens will pant if they are hot. Chickens can cough or sneeze if their house is dusty, maybe from hay. Poisoning by organophosphate insecticides can make chickens gasp and drool. High levels of ammonia in the chicken house can cause weeping eyes and sneezing. A chicken who suddenly can't breathe and is turning blue might just have a piece of food stuck in her throat. And many respiratory diseases also make the chicken gasp and cough, including infectious bronchitis, aspergillosis, and of course avian flu. But gapeworm does not cause runny eyes or nose, or the gurgling lung sounds of congestion, nor swollen eyes or diarrhea. So if her nose, eyes and lungs appear clear, it's probably gapeworm rather than a bacterial or viral respiratory disease. The most definitive way to diagnose gapeworm is by finding large bipolar nematode ova in a lab test of the chicken's droppings. If we need to treat for gapeworm, there are a few options. The main classes of antihelminths suitable for use against nematodes in chickens are the Benzimidazoles, such as Fenbezadazole and Flubendazole, and an Imidazothiazole called Levamisole. Not all worming treatments do kill gapeworm, so check out the active ingredient. Different products are administered in different ways, so do check with a vet about dosage and directions for use, as well as any egg withholding period. When my chicken looked like she was suffering from gapeworm, my vet advised Panacur Aquasol, which contains Fenbezadazole. She worked out the dosage for me and dispensed just enough for my few chickens. It's a liquid suspension, so it needs to be mixed well before each use, and then it's added to the chicken's water. It's usual to treat the whole flock because if one of your chickens is showing signs, probably the rest of the flock have a few gapeworms too. It's still only a suspension, so it will settle out again eventually. Of course, if using your chicken's water to administer medication, you need to make sure they don't have access to other supplies of water. This was easy for me because I was using this simple homemade waterer. And I was lucky, my chickens didn't seem to mind a bit. I have heard that some people need to add something like blackcurrant juice to persuade them to drink medicated water. Remember, most adult chickens who free range will be exposed to gapeworm, and most will either naturally resist infection or will be carrying just a few worms that are not causing her any distress. But if she's clearly having trouble breathing, losing condition or looking ill, then maybe she needs your help to get rid of a nasty little red worm in her throat. She'll be well and happy again in no time. Thanks for watching. Best wishes to you and all your chickens. Bye for now. See you next time.